If you have tight hamstrings and you stretch them out, and that gives you a relief, but the next day or a few days later, the tightness comes back, know that stretching causes a release of endorphins, and that's what makes it feel good. But that doesn't necessarily mean that it's an efficient strategy against the root cause of the problem. Because oftentimes the perception of tightness comes when somebody has an anterior tilted pelvic position, meaning the pelvis is tipped forward. Because what happens here is that since the hamstring is connected to the back side of that pelvis, when it's tipped forward, it causes the muscle to be stretched. And if this muscle is in a constant stretched position, it's under constant tension. And if you then go and stretch it even further, that doesn't help to relax the muscle necessarily. So what we want to do is we want to learn to tip the pelvis back so the muscle can get into more of a neutral position where it doesn't have so much tension. To accomplish a more posterior tilted pelvic position, we get into a stagger stance where the front foot is pulling the floor back so that you feel that your hamstring and glute muscles get engaged. Imagine you had a bowl of water between your hands and you now want to spill water out the back, so you need to tip the pelvis back. Hold this position for 20 to 30 seconds while you keep your front knee as straight as possible, and you keep trying to tip the pelvis back further and further, letting the hip muscles do most of the job without engaging the core too much. Do the same thing on the other side, and you then stand upright, and you might feel that your pelvis is in more of a neutral position already, which helps to release those hamstring muscles in the long run.